So, welcome to Love Heals Cancer and Zenonco.io. I'm Astha from
Thank you.
Zenonco.io. This is our cancer healing journey talks where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These CHJs are very close to our hearts because many patients tell us that when they listen to other people's journeys, it inspires them, it helps them boost their confidence, and it gives them hope that if others have been able to successfully beat the disease, then why can't they? So thank you so much very much. Thank you so much, ma'am, for joining us today. And could you please
Thank
introduce
you.
yourself and tell us how it all began?
Sure. Thank you firstly for inviting me and on the board. And in fact, y'all have been a lot of inspiration also for me once I joined your group. Besides that, let me just start off. My name is Susmita Rana, and right now this is how I define myself. My cancer is gone for me because I was detected.
Ma'am, could I just, sorry to disturb you, but actually your video isn't visible. I can just hear you.
Hello, can you hear me?
Yeah. Yeah,
Yeah,
ma'am. I think it was a network issue.
yeah. Hunky dory was my life. Everything fine. One day, my husband and me were taking a stroll, and he just looks at me and he says, "Don't you think your tummy is too, coming out?" And I'm quite a fitness person. I do not eat junk. I used to not eat junk food, and I'm very weight conscious. So that like I was like, and awfully wondering why is it gaining. I couldn't understand, although I'm not eating. So I said, yeah, my stomach pains sometimes and it really becomes hard. He said, why don't you go to a doctor? And I was like, no, it's okay. It's just an acidity, that's what it happens. Because I'd been in April month to a doctor and the doctor had said, oh, it's an acidity and you take. But he insisted. And since it was a stomach pain, I went to I didn't go to I went to a gastroenterologist. And I really didn't have a pain. But when I went inside and I told him, this is how, he had to just touch me and I screeched. He said, this is abnormally grown up something. I think you should do a scan. And I'm like, I came out and I told my husband, all doctors, just want to mint money and he wants me to do a scan, how it goes. It's just a pain, and it goes and it doesn't persist every day. He requested me, he said, why don't you do it, do that test and then I'll pay for. I'm like, no, I'm not going to pay. He said, okay, okay, I'll pay for it. I went ahead, I did my scan. It was a Saturday, I remember very well. And he said, we'll get it on Monday evening. I was very cool about it. Like, okay, nothing, there's going to be nothing. To my horror, Monday evening, when my husband collects the report, it shows that there are tumors in my ovary, which is like one is 17 centimeters and one is 10 centimeter. And they advise for a PET scan and C125. Still then, I really didn't know what is C125, So as you know, we all become Google Docs and we start Googling. And I also became a Google Doc and started Googling. To my horror, I checked and I said, oh, this is cancer. I was okay till my elder sister didn't call up and started crying, because by that time the reports had gone to them and they showed it to her friend who's an oncogynac in USA. And she knew it and she was like, I can't lose you. And, she started crying. And I was like, okay. I went to the washroom at my office because I was in the office at that point of time. I cried for 10 minutes, to be very honest. Those 10 minutes were the time when I only cried. And I said to myself, oh, see, listen, you've got it. There is no other two questions, but you need to beat it. I couldn't hear my sis crying. Like didn't want her to cry. So I was told to come back immediately because the doctor said they are pretty huge and I don't want it to burst inside, basically, because if it would have bursted, it would have been in my blood, basically. So I went and spoke to my HR head and she was very kind enough. She arranged a cab and we reached home. Next day we go for a PET scan. I meet my doctor, who's Nilesh Chirodia. He is very sweet. He said, "Don't worry." He only said that we need to operate ASAP. We don't want any kind of thing that it gets burst inside. I still remember the day I was operated. So we did all the necessary tests what that were required prior being operated. It was 1st of July, which is Doctor's Day. So I will never forget. So I was told that this operation is going to be a huge one, a big time, and then like it would be 6 hours or something. There'll be a frozen test done. So first the oncogynac would remove the tumors, then the gynac would remove my ovaries and my uterus. Now I never had a problem in my periods. So I and the test results showed my uterus were normal. So I said, "Why do you want to remove my uterus?" So he was very smilingly said, "One के एक के साथ एक free में आता है." So I said, "ठीक है." I had no options that time. He said, "I have to remove your uterus. We don't want to leave a chance." Fair enough. So, which means that I would go immediately for a menopause, actually. So I had my operation, which lasted around 5 hours. Then my frozen was done. Unfortunately, in my frozen, I tested positive in cancer, and hence they had to do much more cleaning. While doing so, doctor had very categorically told me, naked eye, whatever I can see, I will remove. So even my appendix was removed. And I had around 40 stitches. That's all. I said, "You should have done 50. I would become half a century." I told him that. But he made it till 40 only. uh, I, I think I was in my senses by I started my operation started around 1 o'clock in the afternoon. It lasted till around 6 o'clock. I was in my senses by 11 in the night. I was in the ICU for 1 day for test check for a check. This was my journey, and then I come out. I walked out of the ICU. That was one thing. I was very sure when my husband walked in the ICU. There were only two questions that I asked him. I said, "Am I fine now?" He said, "Yes." I said, "Am I cancer positive?" Because I did not know frozen test results. So he said, "Yes." I said, "Okay." The entire night I just knew I could not let my children down. I couldn't let my husband down, because if I become weak, they'll become more weaker. So when I had left my house, my kids came and had hugged me and said they were crying. So I said, "Listen, nothing is wrong with mommy. Mommy is just going for an operation. Mommy will be back." I had to be back, and I also had to be positive now. Doctor checked me in and said, "You can be shifted to a ward." So when they were shifting me to a ward, I told the nurses, "Don't touch me. I will walk on my own." They said in Marathi that you will feel giddy because you are still. I said, "If I feel, I will hold." And that's when I decided the journey starts. My fight starts now. And I walked out of the ward, and in fact, everybody in the hospital ward, whoever their doctors, nurses, I used to come to meet me, saying, "Who is the person who walked out of this, ward?" Uh, this is how the operation went on. Then the results were waited, the big results, the biopsy report. So I was waiting for my result, and my results come in. So it's like waiting for an exam. You have given your exam, you're waiting for your results, and my results come. So everybody's praying it should be stage 1, stage 2, and I get this news that I can't be anything less than stage 3A. So I was detected high grade stage 3A ovarian cancer. And doctor was very nice. He said, "Listen, this is it. You have to take 6 chemos." I had no idea on that time what is chemo. I only knew this 5th chemo people lose hair, and that's it. So he said 6 chemos. And if you want, you can take it direct, or you want to insert a port, we can do that. We went ahead to inserting a port in me. I went back home. after 7 days in the hospital, because the stitches had to be removed prior I go for my chemo. It took me 15 days. Post that, I went to the chemo doctor, who's a different doctor, Pritam Kalaskar, who's another absolute sweetheart doctor. Uh, he explained me everything. What is chemo? How is it going to happen? The best thing is that as a patient, you really need somebody who doesn't listen, who doesn't cut short you, like who answers your question. And I'm a kind of a person who had a lot of questions and queries in my head. How is this process going to? So he heard me out and he answered all of my questions. I
Mom, I think we lost your voice.
I was a sports person, so I took it
Okay.
as a process where there'll be 3 league matches, then I'll go into
Yeah,
semis, quarters, and the finals.
finals. Yeah, right. Okay. So it
So
was, hmm,
that's how I would say my journey started, and I completed my chemo just last month. And
right, ma'am. So it was very brave of you.
yeah, I had see. I would to be very honest. People walked in who came to meet me said, "Oh, suddenly people who know me had cousins, sisters, brothers, uncles, aunties who had suffered, and they used to say these sad stories, nahi hua, and they used to throw up, or they became very weak. Asta, there was a point that I decided that I'm not going to hear to anyone else. I'm not going to hear to anybody. I heard all their stories, but I decided it's my journey, my way. So, and second thing I realized ki, I'm not a science student, but I knew one thing, the brain passes messages to your body. If you even have to
Uh,
finger, basically,
yeah,
you have to, there's a message that's passed to your finger. So if brain is the controlling point, then brain will control. I have to make my brain very strong so that it controls every part of my body and it doesn't give
yeah,
me that effect. And that's all I knew about myself. I said, this is what it's going to be. I'm not going to, I stopped hearing stories and only kept telling myself and my brain, listen, boss, there's a fight between you and the body. And you got to win because you're on the crown. You're the head. So you got to win. So
yeah.
that's how I took my entire journey very positively. Yeah, they were, I wouldn't say my chemos didn't have a side effect. It did have its side effect, but every side effect had to be taken in a positive manner. I couldn't say, no, it will not happen. I took it, yes, it's going to happen. I need to face it. That's about
Yes, definitely. Positivity is the key. Matlab, it should be like, there are many people who tell different things. There would be many people who say, अच्छा ऐसे हो जाता है कीमो में, and they treat you like a patient. अगर आपको मतलब खुद से भी patient की तरह नहीं इतना करना है, so they treat you, they make you feel like one. But अगर अपने आप से there is so much of positivity, hope and everything, so we definitely come out of it.
you have to believe in yourself. I think every chemo, every cancer is different. Every
Yeah.
chemo is different. The only thing that is common in सब में एक ही चीज कॉमन होता है. सब कैंसर अलग होता है, सब केमो अलग होता है, सबकी बॉडीज अलग होती है, पर एक ही चीज कॉमन है इन सब में, योर विल टू फाइट. योर
Right.
विल टू फाइट इज समथिंग कॉमन. आपको कितना लड़ना है, आपको कितना झगड़ना है इन चीज से, आपको क्या बनना है इनमें से. आप एक, do you want to become an empathetic person or sympathetic person is up to you. Do you really want sympathy or do you want to be a fighter? And मुझे sympathy जरा पसंद नहीं आता था. जब लोग मुझे हंसते हुए ऐसे, अरे अरे, I used to not hate,
Right.
I used to hate it because मुझे पसंद नहीं as a person. So like you rightly said, कि you have to stop listening, stop just listening to all these things.
Yes, ma'am, very true. So, like, I had a question. Like, did you have any family history in cancer, or did you have any pre-existing comorbidities?
Now that was another new chapter that I was asked to do genetic testing. So I didn't know what was that. To the best of the knowledge, I don't have my parents and my uncles right now, and the cousins didn't know uh, that anybody had or didn't have. So at both the sides, I would say, my paternal and maternal both. But since doctor said, we went ahead for a genetic testing, and डॉक्टर हैड ऑल्सो एक्सप्लेन कि उन्होंने कहा कि देखो जेनेटिक टेस्टिंग पॉजिटिव आता है तो बेटर होता है क्योंकि तुम्हें कई रीजन तो पता चलता है और उसके लिए एक मेडिकेशन भी है जो तुम्हें लेना पड़ेगा तो ही हैड प्रिपेयर्ड मी मेंटली कि अगर पॉजिटिव आता है तो 2 साल के लिए एक मेडिसिन है जो तुम्हें लेना पड़ेगा तो आई वाज लाइक ओके ठीक है आई वाज प्रिपेयर्ड फॉर दैट एंड आई वाज लाइक क्या पता आई मीन आई डिडंट नो आई डिडंट वांट इट एंड ही आई सेड अगर नहीं आता तो ही टोल्ड मी नथिंग then there's nothing after you finish your chemo we will tell you to do a follow up that's all I waited because it takes a month for the genetic testing reports to come. So I get my report and then I'm positive. So I'm BRCA2 positive. So doctor explains me what is BRCA2, BRCA1 and BRCA2. So in BRCA2, the chances of having breast cancers are higher. Then it's ovarian, and then it's then it comes to intestine, and then it comes to skin. Basically, that's the flow. Basically, the percentage. But I don't get a breast cancer. I get ovarian cancer, and so everything is like roundabout for me. So doctor says, okay, great.
Yeah.
Now you've been genetically positive. So I understand that probably it was in my genes. Now which generation I wouldn't be able to really know because to the best of our knowledges from my sisters and cousins, nobody died or had cancer but now which generation has it come from? मुझे तो पता नहीं होगा अब तो पता नहीं रहेगा तो आई हैव एक्सेप्टेड इट सो माय हस्बैंड हैप्पीली सेड टू द डॉक्टर सेड अरे कुछ और देके गए होते मम्मी पापा ने तो ये भी देके गए इनको सो लाइक इंस्टेड ऑफ गिविंग
Yeah.
अरे प्रॉपर्टी से भी ये भी देके गए so
Right,
anyways
ma'am.
it's
Okay, understood.
there now.
So yeah. And I had one more question. Like, you told that you underwent surgery, then you underwent chemotherapy. So, like, did you go for any alternative treatment or any complementary treatment, like Ayurveda and all?
Yes. So before even starting my chemo, I started my Ayurvedic treatment. I started because I realized my immunity is the factor which plays a very important role in cancer being triggered or getting cancer. That's what I learned. So I wanted my immunity to be strong forever. Like now going ahead, I cannot mess up with my immunity at any point of time. My white blood cells have to be the strongest, basically. So I started with Ayurvedic. I know it takes time, but Ayurvedic, kind of heals your immunity, makes it stronger. It'll take time. I started with my Ayurvedic medicines, and believe me, I don't know how to say, but I really never had a very serious issues through my chemo, except for times when I used to have constipation problem and body ache, which I still have because I'm under medication for 2 years. The next 2 years, I'm taking Rupa Parel medicines, which I actually asked on the group also. What is the cost and can somebody help me because they're pretty expensive. And there were two options given to me: Olaparib and Rupaparib. Olaparib was out of my list because it is like 2.5 lakhs per month of medicinal cost. So I went for Rupaparib, which I'm taking, which has its side effects. Other than hair fall, it is like similar. You get less. I fight it out. I have no choice.
Right. Yes, ma'am, right. Yeah. So, ma'am, like often when patients are undergoing their treatments now, there are times when there is a lot of tension, a lot of mental stress. So, like when you were undergoing the treatment, basically that surgery and chemotherapy, so like how did you manage your emotional and mental well-being?
Okay, with my emotional and mental well-being, my source of inspiration जो मेरे था वो सिर्फ 3 लोग, चार लोग, 4-5 लोग थे. My 2 kids, I have a daughter who is 18-year old, my son who is 11-year old, my husband and my 2 sisters. Uh, Whenever I looked at them into their eyes, I saw them, they wanted to see the strength in my eyes. उनको मेरे आंखों में एक स्ट्रेंथ देखती थी. And I couldn't see them crying, I couldn't see them break down. So I knew कि this is it, this is my source of inspiration, this is because of whom I have to live, because they are trying to see that strength in me. It was like, they wouldn't say, but it every time it would be like they come up to me thinking I should be smiling, I should be happy. There were days which were bad, but they pushed me mentally. Like I said, यार मैं हंसूंगी तो ये हंसेंगे, मैं खुश रहूंगी, मैंने अपना खुशी दिखाया तो ये खुश रहेंगे. And believe me, I asked the universe. So I believe into a lot of asking universe, like, कि give me the strength. I want the strength. मुझे चाहिए ये, मुझे ये चाहिए और आपको देना ही पड़ेगा. आपके पास चॉइस नहीं छोड़ रही हूँ मुझे, क्योंकि मेरे किड्स मेरे को देखते. तो just a small incident I like to share. There's a video also, in fact. जो फर्स्ट टाइम मुझे शेव ऑफ करना था, मतलब फर्स्ट केमो के बाद थर्ड वीक डॉक्टर सेड हेयर विल स्टार्ट फॉलिंग ऑफ, हेयर स्टार्टेड फॉलिंग ऑफ, एंड मुझे शेव ऑफ करना था. तो मेरे हस्बैंड ने कहा नहीं और जाने दो. आई वाज लाइक नो, मुझे करना है. एंड आई वाज वेरी प्राउड एनफ. I did a photo shoot also post my shaving off. So I shaved off my hair. Prior shaving off, I cried one day. So my kids come to me and say, why are you crying? I said, I hope you won't be ashamed of your mom. Like, I'm going to be bald. They said, we are not ashamed of you. And so I was very happy. And I shave off on a Sunday. Monday evening, my son walks in and he had shaved off his hair. And he said, I support you, mommy, in this cancer cause. He's an 11-year-old child. And he said, now आपको अभी कोई भी टकलू नहीं बोलेंगी, मैं भी टकलू और आप भी टकलू हो. And he proudly said this. These are very emotional moments for me. And I think ये जो चीजें होती है, with your family supports you and you show back that you also reciprocate with a strong thing कि yes, I am also fighting with the spirit that you want me to fight. I think that takes you on. Like you have to fight. That's it. Mentally, तुम्हें बहुत strong होना पड़ेगा. I can do it. Otherwise, there is no two goes. Like
Yeah, it's very true. Matlab, the incident which you told, it was
yeah,
just, matlab, I don't know, it was just, family is everything.
yes.
The step that he took, it was really to support you, and it was such a nice, the gesture that he showed. So, yeah. So, yeah, I had a question. So, what were your learnings from your entire journey?
Prior this, to be very honest, I was a very I was a kind of a person who was like, जो मुझे चाहिए वो मुझे मिल जाता है. I had a little arrogance being in the position, senior manager, HR, doing well, having everything what I wanted, everything hunky dory, like, हाँ ये अच्छा है, वो अच्छा है. Suddenly life changed 360 degrees, not even 180, 360 degrees. मुझे एक one fine day I am confined to the bed for 15 days, not able. I need help and support. I was a very independent girl. I'm a very independent girl. सडनली ये रियलाइज होता है कि डिपेंडेंसी होती है, एंड डिपेंडेंसी जब होती है तो उसको कैसे बीट करना चाहिए वो सिखाया उन्होंने कुछ. लाइफ टॉट मी, even if you become dependent, you I was dependent for 15-20 days, for people to take me to the washroom, or even to, give me a sponge, so it actually taught me how to fight, because after seventh day, my kids didn't like the bai who used to cook food for them, nashta. So after seventh day, I told my husband when I came back home, I said, मैं सिर्फ खड़ी रहूंगी और चॉप करूंगी और बना दूंगी, because I couldn't stand longer than that. और बाद में उसको बोलो ऐसे ऐसे बना. The fact that I did it was डिपेंडेंसी से इंडिपेंडेंट होने के लिए भी एक स्ट्रेंथ लगता है, एंड इट्स ओके. लाइफ कभी कभी तुम्हें इंडिपेंडेंट बनाता है. यू यू कांट बी सो इगोइस्टिक कि आई एम द बेस्ट और मुझे कुछ नहीं होने वाला. होगा, लेकिन उसको ओवरकम कैसे करोगे वो ज्यादा इम्पोर्टेंट है. आई लर्न, दिस वाज माय फर्स्ट लर्निंग. The second best learning was I never knew I'm mentally so strong that I could fight things. I could fight so much. I always knew I was strong, but I did not know that I was so strong that I can fight something which is not seen. See, you fight with your husband, you fight with friends, you fight with kids, you can fight, but they are seen things. This is unknown, unseen. This is not seen. I mean, I don't know what is there inside my body, and yet I'm fighting with that person. So that required a lot of mental strength for me. And last but not the least, I'm back to work. So I wanted to go back 6 months, 6 months, I think 6-7 months, and I'm back to work. And that gives me more
Yeah.
positivity. Ki you can do it if you want to do it. So
Yeah.
you never lose till you don't want to lose. I believe this very strong. So a winner
Really, this
never
is
quits
very
and a
true.
quitter never wins.
Yeah,
So
exactly.
this is like a winner never quits and a quitter never wins. That's about it.
Yes, very true, very true. I was about to ask you that if you have to summarize your entire journey in a single line, but you already told that, and it is such
Yes.
an inspirational line. Yeah. So
Yeah.
I have one last question from you. Like, what message would you like to give to cancer patients and cancer survivors, and as well as
Uh,
cancer caregivers?
yes. I think cancer goers, before cancer patient and survivors, cancer goers are very, very important. They play a very important role, because trust me, I'm in that group, and there are so many things that you read, you learn, and then you realize, oh, why are you making a mole out? You may making a hole out of mole. Like you make a mountain out of a mole. Why are you doing that? There are many people in not a better condition than you, and still they are fighting. Still there are fighters, and learn a lot from people. Like, since the group is amazing, I learn a lot. I read every of the each and everything, because there's a lot of learning that I do from there. Learn about cancer, more about cancer. I have another the group, the chemo group that we joined. So I had given them an idea, a concept that, sir, everybody who comes to take chemo from you and completes the chemo, you should certify them. You should give a certificate. So it was a very beautiful certificate. If you want, I can share that they had made. And I was the first patient, because he said, तुमने idea दिया तो तुम first patient होगी मेरे लिए. So message was, when destiny chose to stop, you decided not. And keep it up, Susmita Rana. Like, it was that way. So this was a certificate. They have now started giving all patients who successfully complete. It's a motivation basically to. So I keep it. I achieved it. I have achieved it. I mean, it's an achievement. It's not easy to go through a chemo. Trust me. It's not easy. It has its own plus and minuses. Everybody does that, you know. And so I achieved it. That is another motivation. And like you said, I would just tell everybody, देखो तुम्हें ये जंग जीतना ही है. ये जंग आई है तुम्हारे लिए, पर तुम्हें हारना नहीं है. बस हारना नहीं है, हार माननी तो है नहीं भाई. तुम्हारे शरीर के अंदर है, तुम्हारे में ही है, तो तुम ही जीत सकते हो, और कोई तीसरा उसे जीतवा नहीं सकता है तुम्हारे, क्योंकि वो तुम्हारे अंदर है. ये कोई तीसरा बाहर से है ही नहीं. तो तुम्हारा तुम में ही है, तो तुम ही जीत सकते हो. दवाइयां तो सिर्फ तुम्हें एक सपोर्ट दे सकती है, बिकॉज as such there is nothing curable in cancer. There is no curative medicine in cancer. There's only preventive medicine. तो है तुम्हारे में ना, तो लड़ो ना अपने आप से, जीतो ना अपने आप से. और कौन जिताएगा तुम्हें? कोई बाहर वाला तो जिता नहीं सकता, आके तुम्हें कुछ कर नहीं सकता. तुम ही कर सकते हो. तो you are a fighter, you got to win.
Yes, ma'am. It was such a message, all the, the message that you gave and all the learnings that you shared. I hope, matlab, I definitely know that it will help so many patients and caregivers out there. So thank you so much, ma'am,
Thank
for
you,
this
thank you,
wonderful session and
thank
for
you,
spreading so much of knowledge and positivity. Yeah,
thank
thank you
you.
so much, ma'am, once again for
Bye.
joining the
Have a great
session.
day.
Yeah, thank you, ma'am.